infants, failure to thrive is a serious condition characterized by a significantly low rate or rate of weight gain compared to other children of similar age and sex. An infant with failure to thrive may appear drastically smaller than other kids of the same age. Even though the condition is reversible, it is important to address failure to thrive as soon as it is caught so there are minimal interruptions in a child's development.
The main sign of failure to thrive is lower measurements such as height, weight, and head circumference in comparison to other children of the same age and sex. Caregivers may also notice constipation, irritability, and lethargy in the child, and development of physical, mental, and social skills may be delayed. In real life, the difference between infants with and without failure to thrive could be drastic. Here is a visual comparison of the two. An infant with failure to thrive may have comparatively visible bones, frail limbs, a smaller head, or be shorter.
Sometimes the cause for failure to thrive cannot be identified, but in many cases it's caused by an environmental factor. For instance, feeding an infant can be very expensive, so parents and caregivers may struggle with having enough food or proper nutritious food for an infant in the household. If this is the case, there are many resources that can be of help. There are assistance programs like WIC, food banks, breast milk banks, and many more that can help find food and formula for those in need.
Another common environmental cause is improper feeding. Here are some tips to make sure that you're feeding your child properly. Instead of laying the baby down during the feeding, and don't lay it down with the bottle, you're going to want to hold the baby upright with the bottle and feeding it. If you're breastfeeding the baby, make sure the baby latches onto the nipple properly and can suckle well. If you're using formula, prepare the formula exactly as the package instructs. Do not introduce solid foods too early, and try and form a bond with your baby so you both feel comfortable during feeding time. If you follow these tips, it can lessen the risk of failure to thrive.
It is also important to know what to feed a child. In an infant with failure to thrive, some food options may be more appropriate than others. For example, a more calorie-dense formula may be needed. If your baby is starting solid foods, make sure the food choices are age-appropriate and realistic for your infant, and try to find foods that can offer a variety of nutrients to your child. If you need help discerning what to buy and feed your child, you can contact a pediatrician or a dietitian for advice.
While these tips are helpful, they are not a substitute for medical care. If a caregiver notices that a child has decreased appetite, diarrhea, vomiting, lethargy, weight loss, or trouble gaining weight, it is important to schedule with a doctor as soon as possible.
In summary, failure to thrive is not permanent or inevitable, but it is serious. With early recognition, medical care, and support, every infant can come to grow and thrive, and thriving is an opportunity that every child should have.